right, so I'm going to try to go over spinal cord injury in 5 minutes or less. So what is a spinal cord injury? It is objects force against the spinal cord that result in nerve damage. So there is two types. There is complete, where there's a total loss of sensation and motor movement below the site of injury. Usually that's irreversible. And then there's an incomplete, where it's a partial loss of sensation and motor movement. So let's go to the patho, because patho is first with the test. So what does it cause from? Mostly it's from motor vehicle accidents. It can be caused from falls, which has that axial loading. So it's like when you dive into a shallow pool, it kind of like compresses, and it can be caused by gunshot, knife, missile. So the types of damages are hyperextension, forward bending too much, hyperflexion, which is back bending too much. There's compression, compressing together the spine. Usually that's from falls. There's rotation, so twisting, and then there's transection, where it's a gunshot or a knife or a missile that just completely separates. So what does that damage do? Those different things, what do they do to the spinal cord? It kills the neurons. It damages the structure. It demyelates those axons. Remember, the axons are the ones that send motor movement. So it stops those motor movement in the axons, and it can cause bleeding to the white matter in your brain. So the white matter is very important because there's two things involved in it. There's ascending and descending pathways. So the ascending pathways, which think of it this way, like ascending, it's coming towards your brain, that is going to be your sensations. So if I get a cut right now, I'm going to have my ascending pathways take it to the brain and say, oh, Amanda's feeling these sensations here. And then in the white matter, it's going to have the descending pathway that's going to be like, uh-oh, Amanda has those sensations, so what are we going to do? It's going to send motor impulses out. So descends away from the brain to send those motor impulses. So how are you going to diagnose a spinal cord injury? There's an ASIA impairment scale that'll let you know if it's complete versus incomplete. You can do a myelogram, an MRI, and then there's like a skills tool which can be used to guide care for providers. So let's talk about this little cute drawing I made. So again, with the spine, there's different sections. So if you have a C, like C4 or higher, that's going to be cervical. Come here. And so C4 or higher, that's where you're going to see that quadriplegia, which means paralysis of upper and lower extremities. And C4 or higher, you want to make sure you manage the airway. And then thoracic is the next, so kind of in the upper chest, right? And so T6 or higher is where you're going to start to see paraplegia. Paraplegia just means paralysis, usually of like the lower extremities, right? And then you're also going to see in T6 or higher the autonomic dysreflexia. I'll get to it in a second. And then, so thoracic 2, T1 to T12, that's used for balance. And then lumbar, which is L. So if you have L1 or something, that's when it starts paraplegia 2. Then there's also sacral, which we didn't really go over, but just remember, the higher the site of injury, the more complications, the more severe it's going to be. So what are the types of incomplete, so partial losses? There's central cord. So there's damage, if you guys can see, damage to the cervical spine. This is usually from falls, like people, like elderly. So what symptoms are you going to see? You're going to have a loss of motor in the upper, and you might have a partial loss of the lower. So that goes with that incomplete. So complete loss usually of the upper, or like full loss, and then partial of the lower. And then anterior cord, so that's going to be caused from the disc herniation and hyperflexion, so backward bending. And the symptoms you're going to see, I know this was important, is paraplegia. Again, so that loss of movement below the site of injury, but it's also going to be the lower extremities. And then there's a bilateral loss of temp and pain. And there's still a partial sensation of touch and vibration. So let's go to the last one, Brown-Séquard, which is also called lateral. So that's going to be that hemisection from a gun or missile or knife. Sorry, my cat. And so with that too, it's funny because that one actually has the best prognosis. And the symptoms you're going to see on the same side of the, the side of the spinal cord that was injured. On the same side, you're going to see the motor deficits. On the opposite side, it's more going to be sensations, which makes sense. Motor is kind of a bigger issue. So just remember, same side, motor, opposite side is more senses like pain, temp, what else? Light touch. And so I'm over 5 minutes, but this is, a lot. And then complications, spinal shock, which is swelling of the spinal cord, decreased blood flow and pressure, loss of motor function and reflexes, and then it's reversible. So, and then there's autonomic dysreflexia. So it's like the bowel, bladder, skin breakdown. So if I have a full bladder, that could be an irritant and send an impulse to my ANS to be on overdrive, right? So my blood pressure is gonna, and that causes symptoms of an overactive ANS. So you're gonna see that sweating, the high heart rate, what else? It's just, you can have, I think it was rhinitis too, right? Flushing, headache, bradycardia, hypertension, vision changes, goosebumps. Other complications can be atelectasis, oh my gosh, collapsed lung, inability to clear secretions, pneumonia, UTI, bladder stones, DVT. Treatment, I think the most important thing here is that methylprednisone needs to be done usually within 8 hours to improve neuro outcomes. Otherwise, just think, what can help those symptoms the patient's having, because it really depends on the site of their injury. Have a good day. I'm sorry this is so long.